Hi, I'm Dr. Tim O'Carrigan, orthopaedic surgeon specialising in foot and ankle surgery and limb reconstruction. Ankle replacements is an operation that I do commonly for the treatment of ankle arthritis to relieve pain, preserve movement, correct deformity. A question that patients often ask me is, how long does an ankle replacement last? And that's actually a difficult question to answer specifically. Ankle replacements actually have been done for quite some time, not quite as long as knee and hip replacements, but they've also been done in much smaller numbers than hip and knee replacements. And the revision rate traditionally has been higher than hip and knee replacements. Ankle replacements are recorded in the National Joint Replacement Registry, along with hip and knee replacements. And at the moment there's about 500 done per year in Australia, as opposed to 50,000 hips and 60,000 knee replacements. Prior to 2015, the revision rate at 5 years was 10%. A revision means when you open up the ankle replacement and you change either the whole ankle replacement or a component of it. And about 50% of those revisions were just replacing the plastic. So you'd call that a minor revision, where the metal components are left in situ. Since 2015, that revision rate has reduced by half. So it's now 5% at 5 years. And we think that with time, we will be able to demonstrate that that revision rate can be reduced further. What's changed for us is new technology that allows us to put our ankle replacements in more accurately, more consistently, more predictably, with better instrumentation and better planning. And the key to that is the patient-specific instrumentation with CT-based preoperative planning and the 3D printed jig that we use in theatre. That's the link that allows us to reproduce in theatre what our preoperative plan was. Now, where all of the ankle replacements we're putting in now are registered with the National Joint Replacement Registry, and the data forms that we're putting in have been also changed, much more comprehensive, and we're looking at ankle arthritis as a complete treatment modality. So we are now moving forward going to record the results from ankle fusions and ankle replacements, and in time we will be able to compare the results of those, both in terms of complication rates, reoperation rates, and patient-reported outcomes. And so that's very exciting because it's an ongoing debate amongst the foot and ankle surgery community about the role of ankle fusion versus ankle replacement and the relative advantages and disadvantages. I'm a strong believer in ankle replacement, and I believe that it is the preferred solution for the treatment of ankle arthritis, if possible. And our indications, our confidence, our ability to deal with the complex mix of deformities that can be associated with ankle arthritis allow us to become more confident about when we put an ankle replacement in now, our intention is to keep an ankle replacement in the patient long term. And that may require a revision in their lifetime. It may require more than one. So the answer to the question is, how long will my ankle replacement last? We want your ankle replacement to last at least 10 years, hopefully much longer, but you can never specifically say to a patient in their exact circumstance how long their ankle replacement is going to last. You can only talk in terms of, these are the statistical results, these are the chances. What I can guarantee is that if I put an ankle replacement in a patient, I will take every possible step to do that technically correctly and to set up conditions to allow that ankle replacement to last as long as possible.